drberkkkaratas. I'm Berk Karatas. We will be talking about non-surgical penis thickening. If you remember, we had previously made a video about non-surgical penis enlargement procedures. There was a 6-month treatment there. Shockwave therapy, PRP, vacuum extenders, etc. were being used. There was also a surgical method for this. In surgery, we were also performing ligament cutting and fat injection, but some patients especially are not asking about penis lengthening, but rather about thickening. They are making a request, and here they want this issue to be resolved quickly. As you know, thickening with fat tissue involves a surgery where liposuction is performed, then fat tissue injection is performed, etc. It's a procedure done under anesthesia in an operating room setting. Today's topic is an alternative focusing on popular penis filler applications in America and Europe for thickening. So today's topic is actually a bit of an alternative, especially the filler applications for the penis that have become very popular recently in America and Europe, and how this can be used for thickening. I just mentioned that these procedures have increased a lot recently. Look, studies, especially those using hyaluronic acid for the penis, are increasing steadily. There are many ongoing studies as well. Now here, especially the Koreans are really good at this. So in 2021, they published a study. It's really a great study. Why are Koreans doing this more? One of the world's largest producers of orthogonal acid is Korea. And in Korea, they can really use hyaluronic acid at a much more affordable price and in large quantities compared to our country and other European and American countries. Yes, in this study, as you can see, the average penis circumference with hyaluronic acid goes from about 8 centimeters to around 10-11 centimeters as indicated by this blue hyaluronic acid. Then it decreases. There is generally a period of decrease, but for example, patients ask how long it takes to return to normal. In my own case, we started with 7 to 8 cm after 2 years. At first it goes up to 10 cm, which is really nice. Then it goes to 9 cm, but it never returns to the same level. Let me say that, of course, I don't have a patient that I've been following for 5 years. We haven't been doing it for that long. In fact, an 18-month study was also conducted here. Look, circumference, after 18 months, that is after 1.5 years, an average of 1.5 centimeters remains. I think this continues. I have patients who are 24 months, 26 months, and 28 months old. They continue to stay between those centimeters. Of course, the fat tissue is also not technically a thickening that lasts a lifetime. Both fat tissue and fillers do not last a lifetime. Eventually, a certain amount decreases. So where is this being done? Look here, the skin increase of the penis is scientifically said to be between the dartos fascia and the buccal fascia. So that's exactly this part. This is the area. So there is also the acros fascia under the skin, right. Underneath it, there is a buccal fascia. It's done between these two. So how is this procedure done? First of all, we don't do it in a clinical setting, in examination conditions, in an operating room or in a hospital. I can do this in my own place. Just like circumcision anesthesia, there is a nerve on the right and left sides of the penis. We numb it. So we sometimes inject 2 or even 3 needles at the base of the penis. We numb it. So we sometimes inject 2 or even 3 needles at the base of the penis. We numb the skin with cream. The hyaluronic acid application takes about 30 minutes, around 25 minutes. We decide how much to use at that moment because we do it in C. I use an average of 10 to 20 cc of hyaluronic acid. I have never used it below that until today. I haven't used more than 20 either. And of course, that's very important. So you're not doing penis lengthening now. It's just thickening. Therefore, to achieve a very thick penis like a ball, because it would look bad aesthetically as well, we're also paying attention to aesthetics a bit. So that's why 20, 25, 30 cc is not done anyway. It's not done in scientific studies either. I'm not doing it either. Usually around 10 cc is enough. People can get up and go home right away. So there's no duration of stay here. Since there's no anesthesia or anything, they go home. Sexual intercourse is usually asked about. We usually say to wait about 3 to 4 weeks after masturbation and sexual activity before engaging again, because when we inject under the skin, those areas need to heal. Also, this hyaluronic acid is not something that behaves like fat tissue. It generally stays where you put it, very rarely moving around. it moves very little inside the penis. So generally, it stays where we put it. We usually wait 4 weeks before engaging in sexual activity. There is no change in erection. Especially, I'm looking for which patients are more suitable, specifically those who are only happy with their penis length and want to do just thickening and who have a bit of premature ejaculation. In other words, it can increase the duration somewhat in patients with premature ejaculation. Of course, this is not a treatment for premature ejaculation, so let's apply a filler here to prevent premature ejaculation throughout the entire penis. It's done on the head of the penis, but there's nothing to prevent premature ejaculation. But let's do it on the entire penis, and there's nothing to prevent premature ejaculation. In the studies conducted and from my own experience, it reduces sensitivity a bit. This reduction in sensitivity refers to the sensation of ejaculation, not the feeling of pleasure. Just to clarify, it can help delay the sensation of ejaculation a bit, and it can only be used for penis thickening. So this is a preferable method. Much more reliable than oil injection. I think it is. The side effects and complications are fewer. First of all, there is no surgery involved. It's being applied in incredible numbers, especially in America. As a result, hyaluronic acid injection into the penis is especially useful for those who do not want to lengthen it or whose length is sufficient. It's a quite suitable and reliable treatment for those who want thickening and have a bit of premature ejaculation. Thank you.